Most misunderstood facts about hip replacement surgery. What's the right age for surgery? Well, there is no right or wrong age for doing a hip replacement surgery. There are some diseases which can damage the hip joint at an early age, like avascular necrosis, ankylosing spondylitis, hip damage due to fracture of the acetabulum, which is the fracture of the socket of the hip joint, or rheumatoid arthritis. If your hip joint has been completely destroyed, then hip replacement surgery, irrespective of your age, is the best treatment for you. In the old age, people can have hip pain due to hip arthritis, or due to fractured neck of femur, or due to AVN. At that age also, hip replacement surgery can be performed very successfully after doing your proper medical checkup. All the hip replacement surgeries are the same. Well, that's not true. No two humans are same, so no two hip replacement surgeries are same. We perform hip replacement surgery using different sizes of implants, and the size of the implant is decided by the bony anatomy of your body, and the implant is placed in a position which is best suited for your needs. Also, the surgical techniques have advanced so much now. We use smaller incisions, we do minimum damage to the muscles around the hip joint, there is minimum blood loss during the surgery, and patients are up and about within 24 hours of surgery. In fact, patients who have good bone quality, we encourage them to put full weight on their operated leg on the same day. While if your bone quality is poor, or if you are in old age, then we gradually increase the weight bearing on the operated leg. For younger patients, we always choose ceramic on highly cross-linked poly, while for older population which is 70 and above, we can do metal on highly cross-linked poly also. So no two hip replacement surgeries are the same. Life of hip replacement implants is 10 to 15 years. Well, that's not true, friends. The first hip replacement surgery of the world was done in 1960. Imagine the type of cars were being used at that time and the kind of cars we use now. Imagine there were no mobile phones available at that time. So friends, technology has come a long way, and so is the hip replacement implants. The implants which we use for our patients now, in 80% of the individuals, they last 25 years or more. And technology is constantly improving. So in coming times, we expect the implants to last for 35, 40 years or maybe more. A lot of complications happen in hip replacement surgery. Friends, complication is not a norm in hip replacement surgery. Like any other surgery, complications can happen, but there are ways to prevent it. There are certain things which you can do, and there are certain things which we do. What you can do, you can try to maintain your weight if you're not able to lose your weight. You should quit smoking. You should do some hip exercises as much as your body allows. You can have sessions with the physical therapist, and they may help you in doing the exercises in the right way. And what do? We use the best surgical technique for you with minimum blood loss. We use the best implants for you, and we put them in the best possible position for your body. And that's how excellent results are achieved in a hip replacement surgery. Old people think that pain in the joints is inevitable. So I would request you not to accept pain as the way of living your life even if you are old. If your hip has arthritis, or if your hip has fractured, there are ways to take care of your hip pain, and that pain can be completely eliminated by a successful hip replacement. When will I start moving after hip replacement surgery? Well friends, most of our patients who have good bone quality are allowed to walk full weight bearing within few hours of surgery. But yes, it can vary from patient to patient. If your bone quality is poor, or if your primary condition for which the hip replacement was done needed a lot of bone grafting or reconstruction or special implants, then we give gradual weight bearing which increases over the period of weeks, and by 3 to 4 weeks we allow most of the patients to put full weight on their operated leg. Patients think that their days of having fun and going out with friends or playing sports are over. Well, that's not true. We allow all our patients to do swimming, to play golf, to do cycling, to do biking, to do hiking, or to go for picnics with their friends. And most of my patients are able to live a near normal life after a hip replacement surgery. Because a well-performed hip replacement surgery should be able to give you a joint which feels natural and which allows you to do all your activities of daily living, like sitting on the floor or squatting. That is also allowed. So practically most of our patients are back to their normal lives, and they don't even remember that they had a hip replacement surgery. And ladies, yes, you can wear high heels after hip replacement surgery.